Welcome to Healthy Steps, brought to you by Utica Park Clinic and Hillcrest Healthcare System. I'm Amanda Armstrong. Today we are joined by diabetes educator Christy Covey, who will go over how to use an insulin pen. Welcome, Christy.
Thank you, Amanda. If you or a loved one has diabetes and has been prescribed insulin, there are a few things you need to know. Many types of insulin are available, and your healthcare provider will determine the type of insulin, your dose, and administration times. It is important to know the ways insulin can be injected and the parts of the body that are potential injection sites. It is understandable if you are anxious or nervous about injecting insulin at first, but it will become more comfortable with a little practice. To ease your anxiety, I'm going to show you how. Let's get started. There are three primary tools to inject insulin: syringes, insulin pens, and insulin pumps. Today, we will concentrate on the use of insulin pens. There are 4 areas of the body where insulin can be injected: your abdomen, back of your upper arms, outside of your thigh, and some areas of the buttocks. The preferred area to inject insulin is the abdomen. It provides the best absorption and is fairly easy to reach. Make sure to rotate your injection sites, avoid your belly button, and avoid injecting into scars or stretch marks. To use your insulin pen, follow these steps. First, wash your hands. Then, remove the cap from the pen and wipe the rubber stopper with an alcohol pad. Remove the protective tape from the pen needle and screw it onto the pre-filled pen. Never place the needle on the pen until you are ready to give an injection. Then, remove both the plastic outer cap and the needle cap on the needle. Give an air shot or prime the needle. To do this, dial the dose selector to 2 and with the needle pointed up, press the button and make sure a drop of insulin comes out of the needle. Make sure the dose selector is back to 0. If you do not see an insulin drop appear, repeat steps until a drop of insulin appears at the needle tip. Next, dial the dose selector to the number of insulin units you need to inject. If you pass the number of units you need, the dose can be corrected by dialing back and forth on the dose selector until you have dialed up the correct dose. Then choose your injection site. Push the needle into the skin at a 90-degree angle. Push the button all the way until the dose selector is back to 0. With the button pressed all the way in, keep the needle in the skin for the slow count of 10 to ensure that the full dose of insulin has been delivered. Keep the button pushed in until the needle is withdrawn from the skin. Finally, remove the needle before replacing the pen cap. Dispose the needle in a puncture-proof container. Here are some helpful tips. Make sure you store new pens in the refrigerator. After you use your pen the first time, it can be kept at room temperature. They should not get too cold or too hot. Insulin pens are only good for a limited time after they have been opened. Bruising or bleeding at the site may occur. It is nothing to worry about. Call your doctor if redness or swelling occurs at the injection site. Your insulin pen should not be shared with another person. Place a new needle on the pen each time you inject, and remember to prime the needle with 2 units before injecting your dose. It is not a good idea to reuse your needles. And don't forget to discard your needles according to the Oklahoma state law.
Thank you, Christy, for showing us the proper way to use an insulin pen.
You're welcome, Amanda.
For more information, please visit uticaparkclinic.com.